Hey, good afternoon. I'm Srihari Naidu. I'm a past trustee of SCAI. I'm also the director of the cardiac cath lab at Winthrop University Hospital in Mineola, Long Island. Within SCAI, I also run a committee called the Interventional Heart Failure Committee. And what I'd like to do now is invite you to a special session we're having at SCAI annual sessions in May on interventional heart failure. The session is titled Interventional Heart Failure from Hemodynamic Fundamentals to Interventional Approaches. The impetus behind this session was really to partner with our heart failure colleagues. So this is a joint session between the Heart Failure Society of America and the SCAI. And this really comes from an idea that we had a few years ago, that one of the main areas that we can really make a big difference in cardiology is heart failure. And if you look at most of the therapies that we do today, from multivessel revascularization to TAVR to MitraClip to stem cells to the parachute device, to renal denervation, in fact, many of these things impact heart failure. And it's becoming increasingly clear in this era where heart failure readmissions and length of stay and cost savings are important, that if we can really fundamentally impact the heart failure epidemic, that is an area we should go. And it is perfectly aligned to all the therapies that we're doing. To get involved in that, we have to build bridges with our heart failure colleagues, number one. And number two, we have to get much better at hemodynamics. We were a hemodynamic field where we really understood how to invasively evaluate our patients and understand how to treat them properly. And we need to go back to those basics. So the session is organized in two parts. One is to fully understand advanced hemodynamics in different disease states. And so we will go through cardiogenic shock, we will go through some of the valve problems, and we'll spend a good amount of time understanding how to evaluate these patients properly so we can really guide our heart failure colleagues in their management. And second, in the second part of the session, we will focus more on the individual therapies that we can bring to the table to treat these patients. So I think you'll enjoy this session. It's very unique. It's really well thought out. Join myself and Naveen Kapoor and Jim Fang from the Heart Failure Society as well. Bring your questions, bring some interesting cases, and we'll have a lot of fun. So I'd like to see you there. Thank you.